You are watching McLaren Port Huron Today's Health, and I'm speaking with Vascular Surgeon Dr. Katherine Foley about vascular conditions that can affect the abdominal area. So Dr. Foley, let's start with that. What kind of conditions can affect our abdominal area?
So just like the circulatory system everywhere else, in the abdomen it's the same things. Narrowing or blockages from hardening of the artery, or aneurysmal disease where the wall of the artery gets weaker, causing an outpouching or a ballooning of the vessel. Typically in the belly we're talking about the aorta, and then there's also the kidney arteries and arteries that go to the intestines.
So when we're talking about the aorta, I think a lot of people are familiar with the aneurysm, aortic aneurysms. You hear about. That's a very serious condition.
It is very serious. It's something that people might not know they have because it's more of a silent thing unless you're having troubles with it. But if it does rupture, so just like a balloon, the bigger it gets, the thinner the wall of the balloon gets, and it can get to a point where it could possibly pop. If that were the case, we call that a rupture. That's something that is deadly.
So what are the risk factors for someone to have an aortic aneurysm?
Risk factors for an aortic aneurysm, the number one, first and foremost, just like all the other things, is tobacco use. So smoking highly puts you at a risk. High blood pressure is another thing, as well as genetics do play a role in this, especially if there's a man whose mom had an aneurysm. That's the most significant genetic line that we see.
And you talked about how it can be a silent condition. So what could potentially be some symptoms that someone, would need to be aware of?
If people notice something like this gnawing or nagging pain in their back, a pulsatile mass in their abdomen, or some belly pains that are just kind of you can't really decide what it is or more vague. But a lot of the times the majority of people I see in the office come because they've had an MRI of their back or a CT scan of their belly that incidentally found this large size aneurysm.
So you had said the pulsating mass. Explain how someone might, like what that would look like or feel like.
Yeah, if you're laying flat and you're feeling on your abdomen, typically if you have a large enough aneurysm, you can feel that as a pulsation. Sometimes it can be normal, especially in thinner people, to be able to feel that pulsation, but it's more so the size of it. If it's something that's pretty broad through the abdomen, it might be something you need checked out.
So you had talked a little bit about it, but let's talk about the causes for an aneurysm.
Aneurysm itself, again, tobacco use is the number one cause of getting them. It has to do with the wall of the lining of the aorta, and it becomes more thin as it turns over the certain fibers. So tobacco and the toxins cause that issue. And then again, genetics, hypertension or high blood pressure are significant players in that.
And how would you diagnose it?
Usually a surveillance ultrasound is the first thing we recommend, and any male over 65 who's ever smoked, or any female for that matter who's ever smoked at that age, even one pack of cigarettes in your entire lifetime, you are eligible for a surveillance ultrasound just to see if you have an aneurysm. And then also men who have a family line or a family history who are over 55 are recommended to go undergo a surveillance ultrasound. And then going on that, depending on the sizing, if it's something we're talking about getting ready to fix, then we do other testing like a CT scan.
So this surveillance, that would be something that someone would talk to their family doctor about during a wellness exam then?
Exactly. Talking with your primary care provider about it, or you can make an appointment at our office and we're able to do our surveillance ultrasounds right in the office.
So let's talk a little bit about treatment, how you treat this condition.
Perfect. So treating the aneurysm, there's a couple of ways to do it. One is the good old-fashioned open way. It's where you make a big incision in the belly and cut down to the area where the aorta is, and then basically bypass that area with a graft itself. So we take out the aneurysm and the aneurysm is gone. The other way is an endovascular approach. So looking at this little example here, here's your aneurysm. These are the arteries that go to the kidneys, and then these are the arteries that go down to each leg. In order to fix it through the inside of the vessel, we'll talk a little bit more about it, but we're able to put in a stent graft and basically just reline the piping.
Very good. And I think you have some images to show us exactly what this procedure is. And what is this procedure called?
This is called an EVAR, an endovascular aortic repair. So through little poke holes in the groin, we're able to go in and look at the aorta and measure where the kidney arteries are, and then put a stent graft in through the inside of the aorta. And it basically seals the area between where the blood was flowing into the aneurysm, and now it's flowing through the graft instead. And now that pressure that was on the aneurysm wall is improved or decreased, so it basically protects you at that point from your aneurysm.
So this type of procedure, how long are people usually in the hospital?
If this is a procedure that we are doing as a planned procedure, typically people come in the hospital one day and they're able to leave the next day, which is phenomenal. The great part about it is that it's through small incisions. The hard part is remembering that you just had a major surgery. So I think people get a little bit too comforted in the fact that they're small incisions and forget that you did just have a major surgery.
So you had commented too, if it's a planned one, this can be an emergent case.
Yes, if it's an emergency or you're having issues and then you go to the ER for, if you're found to have a rupture or a burst aneurysm, we're able to do the same procedure depending on your anatomy, but we're able to do it through the inside of the artery. Your body's just been through so much more stress that typically you're in the hospital for a much longer period of time, usually at least about a week.
And when someone does have a rupture, what kind of symptoms are they experiencing where they would be coming into the ER?
Significant pain in your belly and in your back, fainting, low pulse, low pressures. A lot of the times, 50% of people who have a rupture don't even make it to the hospital. They die before that. So it is a very, very serious issue if you think you might have one to urgently get to the ER.
I think we had some images up then to show some before and after.
Yeah. So this is one of my patients who had an aneurysm. I think this one was about 7 centimeters. There are certain sizes we decide at which we fix it based on the patient and their anatomy and the certain recommendations. But if you see here, it might be hard to see on the television, but there's kind of that lined area around it. That's actually the wall of the aneurysm. And this is where the blood is flowing through it. So the space between where the blood is flowing and the wall of the aneurysm tends to have some clot in there. That doesn't mean anything, one thing or the other. That's just the way the normal mechanics of an aneurysm work. And then afterwards, when we seal it off, you can see these are the arteries that go to the kidneys, and this is the artery down each leg. So basically, we put in like a new pair of pants that line that area of the aneurysm.
And this is the same image as you showed on the model as well?
That's correct.
So the difference of an open procedure versus this procedure, what would patients expect?
So depending on the patient's anatomy, puts to which way we would need to treat the patient as what kind of surgery you would be having. If you do undergo an open procedure, it's a longer recovery time because we do need to make a long incision in the belly through the abdominal wall and through the muscles. So the recovery in the hospital itself is usually about 5 to 7 days, and then subsequently there's a lot more rehab or recovery after that going forward. It's just a big stress on the body to have a big surgery, but if you need it, that's the best way to fix it.
So this is a really important condition for people to realize that they have and when they need to seek treatment.
Indeed, and definitely going and looking to get an ultrasound if you might think you qualify.
Great, this has been really good information for our audience. Thank you so much for joining us.
Thank you.
And thank you for watching McLaren Port Huron Today's Health. If you would like more information or to schedule an appointment, visit our website at www.mclaren.org/phvascular. To watch additional videos, visit our website at www.mclaren.org/phvideo. Thank you for watching McLaren Port Huron Today's Health. I'm your host, Kelly DiNardo, and we'll see you next time.